Video lecture pediatrics, and in this video I'm going to talk about OZEN'S criteria for PAN, that's polyarteritis nodosa. So you know very well about this disease. It's it's a multisystemic involvement, right? Like the patient will have fever, hypertension, abdominal pain, some patients have arthritis, right? So we're going to talk about this disease in detail in a separate video, but in this video I'm going to just tell you about the OZEN'S criteria for diagnosis of PAN, right? So to diagnose this through the OZEN'S criteria, it can be made in the presence of one major and four minor, or two major and three minor. One major and four minors, two majors or three minors with three minors. Okay, right guys. So in major we have renal diseases and musculoskeletal diseases. If you read about the clinical features, you will remember what are the musculoskeletal diseases, what are the renal involvement. And renal involvement is really very important because it contributes to the major criteria for this diagnosis. And in the minor criteria, we have so many things like cutaneous manifestations, like gastrointestinal involvement, peripheral neuropathy, so CNS diseases, hypertension, cardiac diseases, the lung diseases, right? And even the lab findings like raised acute phase reactants, presence of what you call hepatitis B surface antigen, is these are the things that you see as what you call you can see in these patients, and these are considered as a minor criteria. So for a minor criteria, let me repeat once again for you guys: cutaneous manifestations, the gastrointestinal, the cardiac, the lung, the hypertension, the CNS involvement, the peripheral neuropathy, the lab findings like increased raised acute phase reactant, and the presence of hepatitis B surface antigen, right? And even constitutional symptoms can be seen in these patients, so they are considered as a minor criteria. So just if to make it simple, I would like to tell you to remember as only the major criteria like renal and the musculoskeletal diseases. They are considered to be as the major criteria, right? And you know very well the treatment of this is what you call cyclophosphamide therapy along with oral prednisolone, right? So we're going to talk about that later in the separate video. Okay, so thank you so much for watching this video. Take care.